morning. Good to see you.
You too, sir.
Good morning.
Morning, sir.
Morning.
How are you?
Good to see you.
Good to see you.
Good to see you. How are you? Good morning. Good morning. Good morning. Good to see you. Good morning. We know what about No, no, I don't know that much. and say, these are the people. Yeah, if I had all 50 of those names someday, all right. Oh, yeah.
Dead. Hey, I just did a workaround. Disregard. Thank you. Bye. You said it. Testing. Testing 1, 2. Sound check. Testing, testing. 1, 2, 3. Audio check.
get seated. Yeah, make sure everybody gets in. We got to pull them, don't we? Yes. Good morning, everyone. The committee will come to order. Thank you for being here as we meet to mark up H.R. 4242, the VA Care in the Community Act. I'm proud to sponsor this bill and have every single one of you joining me as original co-sponsors. Achieving a unanimous bipartisan show of support on legislation of this complexity, importance, and cost is a testament to the spirit of this committee and to the hard work we've accomplished together over the past year. I'm grateful to each of you, and in particular Ranking Member Walz, as well as our partners in the Veteran Service Organization community and the administration for helping to get us here today. Before we begin our work this morning, I'll yield to Ranking Member Walz for any opening remarks that he may have.
Well, thank you, Chairman, and thank you all for being here. And again, I think all of us have earned each other's respect. We've earned the reputation of working together. And while it's true we all moved the ball forward on this piece of legislation, that was prior to what happened last month with the CBO. That was also prior to talk of authorizing caps that we're going to talk about today. We all understand that care in the community has been around forever. Streamlining those processes to make sure when VA is unable to deliver that care that we are able to, or if it's geographic limitations. There's general agreement amongst all of us on eligibility criteria, which will define VA's role in determining where veterans receive their care, and on provider agreement language, which will ease the burden on small providers. Those were some of the hurdles that we worked on together to support this comprehensive bill. We almost got there last month, then the CBO score came in. So we're back again today. And I'm disappointed instead of addressing that issue head on, we are going to contort ourselves around to try and make some artificial caps that aren't going to ever get us closer to understanding the true cost of care in the community. I don't question anybody's commitment to getting this done right, but I think we all need to be very clear. It is a stark contrast that on this day, and probably in the middle of this markup, we're going to talk about putting caps on here and limiting care and not having the honest discussion as CBO got us as we walk to the floor and people cast a vote to reduce taxes on the wealthiest, add $1.5 trillion to the deficit, and I would make this suggestion to you. If we simply took off 0.5% on the carried interest tax for hedge fund managers, we wouldn't be having this discussion today. We would be having the discussion about how could we best fill the bill. So I'm disappointed that we're there. I understand your ideological belief in this. I only wish there were a way that you could find the original Adam Smith and have him on this committee so that his invisible hand could move those tax cuts dollars to the choice in the VA program to ensure that we are able to get the funding that is necessary. Because when we come back again next year, and the deficits are there, and the money is not there to pay, you're going to sit in these very chairs and ask yourself, are you going to cut that care? Are you going to move it from VA? Are you going to ask the taxpayers to pay more, or how are we going to get there? So the caps that have a 3% growth rate each year hamstrings Congress and the VA if the need is higher. The need will be higher. I say that without any sense of wisdom or anything. I say it with the sense of history that we'll be at. It'll be closer to 6%. There's no reason to believe care in the community won't grow even faster. We honestly don't know what our baseline in spending will need to be under this legislation because the authorizations for community care will grow. The tax bill under consideration will remove the ACA mandate, and without those funds, an estimated 5 million people will lose coverage through the individual market, another 5 million through Medicaid. If these provisions pass, veterans who can no longer use the ACA, and there are millions of them, will have no other option if they can't go to Medicaid to go to the VA for care. If that's true, this committee introduced a bill with every committee member as a co-sponsor, but before any of those things were in play. The Senate Veterans Affairs Committee passed its version 14-1. On policy, we are all in line with each other. But when it comes to funding, this is where we're at the crossroads. So I'm going to ask all of you, we could go back and we could have this discussion. We could ask the Speaker to do an open or modified open rule to allow just one Democratic amendment to the tax bill this afternoon that takes that 0.5% from the carried interest and transfers it to the choice program to allow us to be able to pay this at where it needs to be. We'd have an honest discussion with the taxpayers. I think those hedge fund managers would probably be more than willing to offer up that money. We would be able to fund this accordingly, and we would not get ourselves in what is going to be a night. All of you are going to deal with this. In the next Congress, you are all going to deal with why there isn't enough money there, why that program ran out. So I want to be very clear. The chairman's ability to work on this should not be questioned. He has come to us and asked for these suggestions. We have sat down together. We have worked these things out. We're getting very close on provider agreements. I am going to offer today an amendment in the nature of a substitute that is basically going to end up being what the Senate version is going to ask for, and it's going to be the compromise where when we conference this together where we're going to end up. So I would ask all of you before you go down today, because again, it's a very stark contrast vote, you're going to put caps on here that by the CBO says are artificial. They're underestimating the cost of this program. And at the same time, we're going to go down and vote for tax cuts saying the federal government has too much revenue right now and too much money from the taxpayers, and we need to make sure we give that back to those folks. So I ask my colleagues, in the spirit of this committee, this is going to, by all accounts, because of sheer numbers here, move forward. It does not fix the problem. It will come back to us again. You will vote on this again. It will be modified to reflect the reality of where the CBO score is at, and we will be able to once again get what we all know we want to do, an honest ability to provide care in the community while being honest with the taxpayers about the cost and doing something again. Tax bills, these types of bills, are more than just fiscal documents. They're a reflection of our values. If we really want to deliver care in the community, let's go back and have this discussion on these caps and fix that. And with that, Mr. Chairman, I yield back.
Thank you, gentlemen, for yielding. And I'm not here to discuss the tax bill today. I'm here to discuss the policy of how we provide care for our veterans. So I'll now call up H.R. 4242, the VA Care in the Community Act. Clerk shall report.
H.R. 4242 to amend Title 38 United States Code to establish a
The
permanent
bill was
VA care.
circulated in advance pursuant to committee rules. Without objection, the first reading is dispensed with. H.R. 4242 would create a permanent consolidated VA care in the community program. Rather than rely on arbitrary administrative criteria and decisions made by bureaucrats rather than patients, this bill would put the veteran and their provider front and center in all care decisions, including decisions regarding community care referrals. It would ensure that when a veteran is referred to the community, the care that veteran receives is coordinated by VA, and the reimbursement that community provider receives from VA is timely and accurate. It would remove all of the complicated, confusing, and contradictory rules and requirements that govern VA care in the community today and install in their place a single program that is easier to understand, easier to administer, and that works when veterans need it to work. H.R. 4242 would also provide limited provider agreement authority to ease the delivery of care to veterans when a formal contract is not available or achievable, and facilitate greater sharing of medical documentation between VA and the community to ensure that the care veterans receive is seamless and safe. In addition, the bill would improve access, capacity, and quality in VA medical facilities by requiring regular local assessments to identify where gaps in care exist and how they can be resolved, mandating standardized productivity and performance metrics for VA clinicians, and authorizing VA providers to practice telemedicine across state lines. Over the last few months, I've met with either one-on-one or in small groups with most of you to discuss this legislation. As a matter of fact, we started back when I got this chairmanship and made a decision that this was going to be a bipartisan bill that both parties, both sides could enter into and have input to, and we have done just that. And I think we've got a great bill. These meetings were in addition to open and ongoing conversation we had in public as a committee over the last year, starting with March the 7th full committee oversight hearing, followed by the October 3rd full committee roundtable, and the October 24th full committee legislative hearing. I'm very proud of the careful, deliberate, transparent process that this bill has gone through, and I believe the hard work we put into that process, regular order and then some, has paid off in the bill before us today, as evidenced by every committee member co-sponsoring this bill. However, achieving passage of this bill will be the start of our work, not the end of it. I take this committee's constitutional oversight responsibilities seriously and intend for us to monitor an implementation of this legislation and the management of additional authorities and funding it will provide like a hawk to ensure that taxpayer dollars are used responsibly and veterans are cared for appropriately. I want to assure members that there will be an opportunity for us to make enhancements, adjustments to the program as it's implemented. I also want to reiterate yet again that this bill is intended in no way, shape, or form to privatize VA healthcare system. The bill is intended to create a stronger VA healthcare system, one that is farther reaching, more agile, and better able to provide our veterans with the care they need, when they need it, where they need it. Once again, I'm grateful to every single one of you for your hard work on this legislation. While we've have had disagreements and bumps along the road, we've come together and created the bill that all veterans can be proud of. I know this veteran is. The bill is now open for amendment. At any point, I ask unanimous consent that the following amendments be considered en bloc. Amendment 2 H.R. 42 is offered by Representative Rutherford of Florida. Amendment to H.R. 4242 is offered by Dr. Dunn of Florida. Amendment offered by Representative Kaufman of Colorado. Amendment to H.R. 42 offered by Representative Gonzalez-Colon of Puerto Rico. Amendment to H.R. Representative Brownlee of California. Amendment 2. Amendment H.R. 40 to H.R. 4242 offered by Mr. Bilirakis of Florida. Hearing no objection, so ordered, the clerk shall report.
An amendment to H.R. 4242 offered by Mr. Rutherford.
Ask unanimous consent that the formal reading of this of the en bloc amendments be dispensed with. Hearing no objection, so ordered. My staff conferred with ranking member's staff, and we have an agreement to accept 6 of these amendments en bloc. Do any members wish to comment on the en bloc amendments to H.R. 4242? Mr. Rutherford, you're recognized for 5 minutes.
Thank you, Mr. Chairman, and Ranking Member Waltz and fellow members of the committee. I want to thank you for the opportunity to speak on behalf of my amendment to H.R. 4242, which is included in this en bloc amendment, and for having this important markup today. It shows your commitment to getting the community care programs truly right for our veterans, and I'm glad we are moving this before the new year. However, the conversation on community care does not happen in a vacuum. As we have heard on this committee time and time again, we cannot truly fix this system until we address the shortfalls within the VA itself, and that is why my proposed amendment today is so critical. Several times at this committee, I've heard from members on both sides of the aisle how concerning the physician shortage at VA is to everyone. This shortage has a negative impact on the care of our nation's veterans, including longer wait times and a decrease in the quality of care they receive. There are a few reasons for these vacancies that they exist, but the reason I am most concerned with is the mechanism through which the VA recruits, hires, retains quality providers to ultimately give the best care possible for our veterans. Currently, the VA has several programs to address recruitment in their profession ranks, including the Education Debt Repayment Program and Health Professions Scholarship Program. And despite these programs, as well as the 1,500 residency slots provided by the 2014 choice legislation, physicians still remains the VA's top mission-critical shortage position. Considering these shortfalls, along with the fact that half of all physicians will be, physicians and nurses, I suspect, will be eligible for retirement within the next 10 years, the time to act is now. My amendment makes 3 primary improvements to these programs. First, it requires the VA to provide scholarships to students studying to become physicians or dentists while the shortage of professions is 500 or greater. These students will then be obligated to provide clinical service at VA hospitals for 18 months for each year of their scholarship support. Second, this legislation requires the VA to create a pilot program to fund 2 scholarships for veterans at each of the 5 Teague Cranston Act medical schools in the 4 historically black colleges and universities with medical schools. The veterans are obligated to provide clinical service at a VA facility for a minimum of 4 years in exchange for that scholarship. Third, it standardizes and increases VA loan repayment program for newly graduated medical students or those currently in residency who will be training in specialties deemed as shortages in VHA. The loan payments will be a maximum of $40,000 per year with a minimum total of $160,000. Following completion of their residency training, the loan recipients will be obligated to provide clinical service at a VA facility for 1 year for $40,000 of loan repayment, but in no case fewer than 2 years. How we equip the VA to fill its ranks in the future is by giving its leadership the tools it needs to go out and recruit those who are already prepared to care for veterans and offer these recruit incentives to come into the system. Further extending the residency program, as the Senate bill does, is costlier than this proposal and results in care to groups other than veterans. And due to matching systems, results, I believe, in lower quality providers. Accepting this amendment will give the VA the ability to compete with the private sector and will improve care for our veterans. In closing, I'd like to thank you, Mr. Chairman, the ranking members, my colleagues on the committee, and the committee staff for their commitment to this and the other proposed pieces here today that will improve the VA healthcare system. And I urge the committee's support, and I yield back.
Thank you for yielding. Anyone else wish to speak on Mr. Rutherford's amendment, which I strongly support? Anyone else? And just for clarification, Dr. Dunn's amendment authorizes veterans to obtain transplants outside the region of the organ procurement and transplant network if the veteran's primary care provider states that there is a medically compelling reason for such travel. Authorizes the VA to support the cost of a donor transplant operation, including perioperative care for a live donor who is not a veteran. Now, Judge Carter brought us this, an example, who has donated an organ for a veteran. Such procedure may be performed at a non-VA facility. Mr. Kaufman's amendment. Mr. Kaufman, you want to speak on your amendment? You're recognized for 5 minutes.
Thank you, Mr. Chairman. We always hear about the sacrifices our men and women in uniform make in service to our nation, but many do not understand that those sacrifices can leave a veteran in chronic, debilitating pain and with serious mental health challenges. In return for their sacrifices, we as a nation make a promise to, quote, to care for him who shall have borne the battle, unquote. The VA has regularly met the demands of that promise, but in recent history it has been with excessive, that has met that demand with an excessive practice of using opioids and psychotropic medication. In fact, in 2016, 13,928 veterans were prescribed a total of 85,729 opioid medications through the CHOICE program or through a combination of CHOICE and VA providers. Mr. Chairman, as the VA expands their partnership with community providers, we have found that these partnerships are challenged by the lack of critical health information sharing and conflicting opioid prescribing guidelines. Recently, the VA's Inspector General determined that these challenges put veterans suffering from chronic pain and mental health illnesses at particular risk. The EIG also found that without timely sharing of information, VA community providers may not be aware of treatment plans and new medications. This gap in treatment care is risky for our veterans. My amendment tackles these challenges by requiring the VA to establish a process that ensures safe opioid prescribing practices by community providers and the timely sharing of a veteran's medical records. More specifically, it would require a copy of the VA's opioid safety initiative, are provided to all covered community providers, and that they certify that they have reviewed the prescribing guidelines. Additionally, if a veteran receives authorizing or community care, my amendment would require the authorizing document include the relevant medical history and a list of all medications prescribed to the veteran. Each community provider must submit opioid prescriptions for VA authorization to prescribe a limited number of opioids under contracted retail pharmacies or directly to the VA pharmacy, the VA must record each prescription in the veteran's electronic health record, and the VA must monitor the prescription as outlined in the VA's opioid safety initiative. Finally, should the VA determine community providers' prescribing practices are in conflict with VA guidelines, appropriate action must be taken to ensure the safety of all veterans receiving care from that provider. Mr. Chairman, the legislation before the committee today, H.R. 4242, the VA Care in the Community Act, is critical to bringing the VA into the 21st century and increasing timely access to quality health care for our nation's veterans. My amendment will simply ensure that that partnership with our community provider includes the sharing of critical health information and accountability in prescribing practices. As the IG stated, quote, "The opioid epidemic has impacted veterans, and overdose deaths among veterans remain elevated when compared to the civilian population," unquote. My amendment will fight this epidemic. Mr. Chairman, thank you for your support, and I encourage my colleagues to support my amendment as well. I yield back the remainder of my time.
Thank you, gentlemen, for yielding. I strongly support this. We have 6 million men working age that are not in the workforce right now. 44% of them not there because of opioid addiction. Ms. Custer, and then Mr. Poliquin.
Thank you, Mr. Chairman. I just want to thank my colleague, Mr. Kaufman, for this amendment. We've been working together, and I appreciate that. This is an epidemic that is just taking off all across the country. I'm sure it's in your district. We now have a bipartisan task force with over 100 members working together. We call it the Bipartisan Opioid Task Force. I encourage you to join us. We have informal hearings. We've had experts come in from the CDC and et cetera. But one of the places where we've seen the biggest challenge is with veterans because of the real pain that our veterans are dealing with and just the high dosage of opioids that they've been receiving over a long period of time. The good news is that there are very innovative solutions that are coming from the VA that will be helpful in the civilian population to reduce the use of opioid medication and to use alternative pain management remedies, that whether it's acupuncture, physical therapy, mental health therapy, obviously bringing people together to talk about the challenges they face. So I want to thank Mr. Kaufman, and I intend to support this amendment. I yield back.
Thank you, gentlelady, for yielding. Mr. Poliquin, you're recognized.
Thank you, Mr. Chairman, very much. Mr. Kaufman, you did one heck of a job on this. I really appreciate not only your service to our country, but speaking up on behalf of our veterans when it comes to this critical issue. I represent rural Maine, and we are very much impacted in rural Maine with this opioid crisis, not only our civilian population, but also our veterans. And I salute you, Mr. Kaufman, very much. I'm eager to support your bill, and I'm very appreciative. Thank you very much, sir.
Thank you, gentlemen, for yielding back. Anyone else wish to speak on this amendment? No, on Mr. Kaufman's amendment. Anyone wish to speak on Mrs. Gonzalez-Colon's amendment? You're recognized for 5 minutes.
Thank you, Mr. Chairman. I want to thank you, and Chairman, as you are aware, veterans living in the territories have their share of challenges when they're trying to access health care, both within and outside of VA network. In most cases, this results from the limited presence of VA medical facilities on site. And while each of the territories has different challenges because of their geographical location, the veterans residing in them, unfortunately, have this overreaching limitation in common. The amendment I presented will require the VA to produce a report that includes the capabilities of the department to furnish hospital care and medical, mental health, and geriatric services in VA facilities on the territories. Additionally, the report includes an assessment from the department on the feasibility of establishing a medical facility in any territory that does not include proper facilities to accommodate these services. This amendment was presented and approved as part of H.R. 4243, the VA Asset and Infrastructure Review Act of 2017, by our colleague, Mr. Sablan. Since he was unable to attend today's markup, I accepted his request to present it today once again. As members of this committee and stewards of the well-being of our veterans, we must ensure that all of them, regardless of whether they live in the mainland or any of the territories, are considered and included in this legislation that aims to improve their lives. And I am so proud of your work here, Mr. Chairman, and letting us participate and co-sponsor in this bill. As Ms. Radegwagen and I, Chairman, I would like to thank you for your unwavering commitment to our veterans, and I will also want to recognize Mr. Sablan for working these amendments together in the past bill and in this one. Thank you, and I yield back.
I thank the gentlelady for yielding back. Anyone else wish to speak on her amendment? Seeing none, Ms. Brownlee, you're recognized for 5 minutes.
Thank you, Mr. Chairman. My amendment today addresses what I believe to be an important issue that I think everyone on this committee strongly supports for the VA, and that is financial accountability. As we are debating the future of VA care and the Choice Program, we should not forget the various financial crises and shortfalls that this program has faced since it was created. Just this summer, Congress passed a $2.1 billion emergency funding measure to shore up the Choice account in the face of veterans losing access to care. And we are now facing another funding shortfall in January. The multiple shortfalls in the care and the community accounts have created uncertainty for veterans, for providers, for this committee, and for taxpayers across the country. That's why my amendment today seeks to bring greater accountability to the VA's finances. It requires the VA to notify Congress 45 days before any veteran's health care or benefits could be cut off for lack of funding, and require that the VA provide Congress with a justification for the request and with a spending plan. This fix will bring greater accountability to the VA's finances and help this committee ensure that veterans are not losing access to care because of financial mismanagement. This language has bipartisan support in the Senate, where it was introduced by Senator McCain and Ranking Member Tester. Mr. Chairman, this is a common sense amendment to help ensure veterans do not lose access to care because of financial mismanagement, and I urge its inclusion in the bill we are considering today, and I thank you very, very much for including this in the en bloc, and I yield back.
Thank you, gentlelady, for yielding. I will be supporting her amendment. Next would be Mr. Bilirakis has an amendment.
Thank you, Mr. Chairman. I appreciate it so much. Again, I think I thank the ranking member as well for holding today's markup for the consideration of my amendment, and I want to thank my co-sponsor, Representative Esty from Connecticut. So I'll go ahead and discuss my amendment. My amendment is a simple, common sense idea that will go a long way in providing program integrity for the health system of our nation's true heroes. The amendment builds upon some of the lessons that we've learned in the Medicare program, which has a $36 billion improper payment rate, believe it or not. If accepted, this amendment will do two things. First, medical providers that have been found and convicted of fraud in the Medicare and Medicaid program will be prohibited from providing health services to our veterans. The Secretary of Veterans Affairs shall verify upon enrollment and thereafter annually that such providers participating have not been excluded from any other federally funded health care programs such as Medicare and Medicaid. Under existing authorities of the Social Security Act, the OIG can exclude individuals and entities from federally funded health care programs and will be kept on the list of excluded individuals/entities. Being placed on such list, as you can imagine, requires serious offenses. Determinations for exclusion status are imposed for a number of reasons, such as Medicare and Medicaid fraud, patient abuse or neglect, health care-related fraud or other financial misconduct, and felonies related to unlawful manufacturing, distribution, prescription, or dispensing of controlled substances. Secondly, the law will require that the VA establish a data analytic program to fight medical fraud. Analytics uses data analysis of consumers, providers, and spending to find patterns that show fraud in the system. Analytics work in two ways. You can do data mining of historical payments to find hidden patterns that reveal fraud and payment errors. You can also use predictive analytics to identify fraud and errors before payments are made. This moves us away from the classic pay and chase model to finding problems before we pay. Makes sense. The financial industry has been using data analytics for years to capture fraudulent schemes. In 2010, then Senator George Lemieux from my state of Florida established a program for a predictive analytic program at CMS to move us from the pay and chase. In 2014, CMS reported that they identified or prevented $210 million in improper Medicare payments using their new analytics program. We need to make sure that the VA has important tools like this to safeguard the choice program so that it is sustainable and not vulnerable to bad actors. As we move forward with the VA Community Care Act and the Community Act, which I strongly support, let's ensure best practices from lessons learned in other federally funded healthcare programs, that we want to make sure that those lessons are incorporated into this bill. I urge all my colleagues to support the Bilirakis-Esty amendment so that we can provide the best quality to our nation's veterans. And I want to yield my remaining time to Representative Esty if she has any comments. And I thank her for working with me on this particular amendment. Thank you. I yield.
Thank you very much. I want to thank the chairman. I want to thank my colleague for his leadership on this issue. We all want to ensure that our veterans are getting the care that they need when they need it. But in addition to timely care, we must ensure that our veterans have access to quality care. And as we send veterans outside of the VA system to private medical providers, we need to ensure that those doctors are capable and worthy of delivering the quality care that our veterans deserve. This amendment would ensure that we are not sending veterans to providers who have been excluded from other federally funded health care programs because of fraud, waste, or abuse. If a provider has been found not eligible to participate in programs such as Medicare or Medicaid, we should not be sending veterans to that provider. Again, I want to thank my colleague, the gentleman from Florida, for his leadership on this, and I urge all of my colleagues to support the Bilirakis-Esty amendment. Thank you.
Very good. Thank you. And I yield back, Mr. Chairman.
I thank the gentleman and gentlelady for yielding back. Do any members wish to comment any further on any of the amendments? Okay, seeing none, the question now occurs on the en bloc amendments. All those in favor say aye. Aye. All opposed say no. The opinion of the chair, the ayes have it. The en bloc amendments are agreed to. Moving on to our remaining amendments. I understand Ms. Esty has an amendment at the desk. The clerk shall report.
An amendment to H.R. 4242,
I
offered
ask
by...
unanimous consent that the formal reading of the amendment be dispensed with. Hearing no objection, so ordered. Ms. Esty, you now recognize for 5 minutes to speak in support of your amendment, your first amendment.
And thank you, Mr. Chairman. Mr. Chairman, my amendment would establish a center of excellence within the Department of Veterans Affairs in the prevention, diagnosis, mitigation, treatment, and rehabilitation of health conditions related to exposure to burn pits. As my friend and constituent, Lieutenant Colonel Mike Zakea said, quote, "Burn pits are the ticking time bomb in this generation of combat veterans." I regularly hear from veterans in my district regarding their concerns about having been exposed to toxic burn pits while serving in Iraq, Afghanistan, and even going back as far as Vietnam. Items such as plastics, aerosol cans, electronic equipment, human waste, metal containers, tires, and batteries were thrown into open pits and set on fire, occasionally using jet fuel as an accelerant. Many of those who are exposed to burn pits report illnesses that could potentially have been caused by burn pit exposure. And it's clear that we need more information about the health effects of burn pits. We should not repeat our shameful inaction after the Vietnam War when the government failed to acknowledge the terrible toll of Agent Orange. I urge all of my colleagues to support my amendment so that we can understand the health effects of burn pits and ensure that our veterans exposed to burn pits get the care that they deserve. Thank you, and I yield back.
Thank you, gentlelady, for yielding. Does anyone else wish to speak on Ms. Estes' Amendment Number 1? Mr. Higgins, you're recognized for 5 minutes.
Thank you, Mr. Chairman. I'd just like to state that my colleague has put her heart into this amendment, and I also have brother and sister veterans that suffer from perhaps the impact of burn pits. And I ask that there be a commitment from the chairman and the ranking member, Ms. Estes, to study this measure further and have proper hearings and discuss this and work together in a bipartisan manner to address this important issue. This is close to my heart. I just ask that we go further as a committee and address this matter through proper order. Thank you.
Thank you, gentlemen. Anyone else wish to speak? I'll start with Mr. Kaufman.
Mr. Chairman, I rise in support of the amendment. I think it's extremely important to deal with this issue, whether we deal with an amendment or a standalone. I leave that to others to make that determination. But as an Iraq War veteran, I can remember going out to forward operating bases in the western Euphrates River Valley, where the Marines you would have a company of Marines in the equivalent of Iraqi soldiers in a compound, in a very small compound. Oftentimes, they would take over existing facilities within a city or a village, a town, and they would be walled, and so and you couldn't take this stuff outside because of the increasing risk of those Marines or soldiers in these forward operating bases. And so you would dig a pit inside this compound. And so I think what you have to understand is that, particularly in the forward operating bases, these soldiers and Marines were in very close proximity to it. It wasn't in a larger base camp. You could put it in a more open area, but you couldn't hear. And so there was really direct exposure to it. And I think it's important for the members to understand that and the health risk associated with this.
Thank you, gentlemen, for yielding back. Yes, Dr. Winster.
I also would like to commit to studying this even further. And, you know, I spent a year in Iraq surrounded by burn pits, and I agree with you 100%. And I hope that we can actually bring more attention to it in a standalone and have more discussions with it and let the American people also be more aware of the concerns that we have for this. You know, I can tell you every time I have a little cough or something now, I wonder if it's because of that. And so I'm with you, and I appreciate you bringing this forward. I hope we can bring more attention to it in another light. Thank you, and I yield back.
Anyone else wish to speak? I will not be supporting this amendment. While we agree that the use of burn pits by the U.S. military certainly requires continued oversight and investigation, I have concerns about the amendment, and let me just tell you why. I don't think this is the spot to do it. In this choice bill, I recommend that and I will commit to you, that we will have standalone legislation. Look, I'm sitting here 50 years after Vietnam, and we still got Blue Water Navy people we haven't taken care of. It's an emotional issue for people. I think we need to, this is a much bigger than just an amendment to a choice bill, I think. I think it deserves either subcommittee and then full committee hearings and standalone legislation, and I'm committed next year to do that if you'd be willing to do that. I recognize the gentlelady.
Thank you, Mr. Chairman. I want to thank my colleagues for their commitment to work together, and I do think it's appropriate. I would hope that we can, in the new year, bring up a full bill, full hearings, and really, again, try to correct early on this exposure, understand what's going on, and learn from the past that literally sticking our head in the sand when it's contaminated is not what we should be doing. We really need to work together. So again, I want to thank my colleagues for their support in pursuing this in a vigorous way, in a serious way, and helping the veterans now when they need it so that they're not left wondering if that cough is something much more serious. So I thank the chairman for his commitment. With that understanding, I withdraw my amendment. Thank you.
Thank you, gentlelady, for withdrawing and to not wait 50 years to do something about it. I thank the gentlelady for withdrawing her amendment. We will proceed next year with that. I understand that Ms. Esty has another amendment at the desk. Clerk shall report Esty Amendment number 2.
An amendment to H.R. 4242.
I ask unanimous consent that the formal reading of the amendment be dispensed with. Hearing no objection, so ordered. Ms. Esty, you now recognized for 5 minutes to support your amendment.
Thank you, Mr. Chairman. This amendment would expand the VA program of comprehensive assistance to family caregivers to veterans of all service eras. Everyone on this committee is well aware of the incredible costs of war to our veterans who find themselves with a permanent disability. And often it is family members who step up to help injured veterans with activities of daily living, such as bathing and dressing, housework, transportation, and administering physical and medical therapies. In 2010, Congress stepped up to offer assistance to family caregivers of veterans. But the program was only made available to family caregivers of post-9/11 veterans. Clearly, those who served in World War II, Korea, and Vietnam, and their families are deserving of the same respect and the same support. That is why our Senate colleagues wisely included a similar provision to extend caregiver support to all veterans in their bill. I urge all of my colleagues to support my amendment and expand this program to support all of our veterans' caregivers.
I thank the gentlelady for yielding back. Does anyone else wish to speak on her amendment? Mr. Higgins, you're recognized.
Thank you, Mr. Chairman. Again, my colleague, Ms. Esty, has presented her heart and study into something that's very close to me. I also support the expansion of the caregiver program to pre-9/11 veterans. I would ask again that there be further study as we move forward with perhaps a standalone bill, because I support, although I support the expansion, Mr. Chairman, Mr. Ranking Member, Madam, of the caregiver program, I also support implementing necessary reforms to prevent waste, fraud, and abuse, which is widely reported within the caregiver program. So I just asked a commitment as we move forward as a bipartisan committee, committed to this important subject that has been existent for so long, that we take our time and implement the necessary reforms within a bill to address existent waste, fraud, and abuse. And with that, I yield back.
Thank you, gentlemen, for yielding. Anyone else wish to speak? Thank you, Ms. Esty. I will not be supporting this amendment. Given this amendment drastically expands the eligibility criteria for the program, which has received little oversight and is not germane to the underlying bill we're considering today. And really today I want to focus on the choice bill. I cannot support this amendment, although I will certainly be happy to work with the gentlelady to address concerns and potential solutions for execution of a fair and efficient caregiver program moving forward. And I think we do need to study this. It's time to, as Mr. Higgins said, to have oversight of the program that's there. What are the new criteria? What's it going to cost? All those things. I think we need to have and the House is very good at this, being open about this, and I'm certainly willing to commit to you to do that in the next year. I yield to the gentlelady.
Thank you very much. I appreciate your support in continuing to look at this because, frankly, I'll tell you, I have World War II veterans in their 90s who are being cared for by spouses or by children. And frankly, they do deserve to have help and support because let's be clear, we would be paying for this if they were in veterans' homes. They choose to get care at home. That is saving taxpayer dollars when they do that. And it's disrespectful not to recognize the sacrifice that these families are making of our most elderly veterans. And so again, I hope we don't wait too long on this. I appreciate and will take the chairman at his word that we will address this again in the new year and take a serious look and not make our most revered veterans wait till a point when they are no longer with us to recognize the support and care of their loved ones who have been providing this for, in some case, decades. So thank you, and with that, I withdraw my amendment.
Thank you, gentlelady, for withdrawing your amendment. I have an amendment at the desk. The clerk shall report roll. Amendment number 1.
An amendment to H.R. 4242
I ask
offered
unanimous
by...
consent that the formal reading of the amendment be dispensed with. Hearing no objection, so ordered. I now yield 5 minutes to myself to briefly discuss my First Amendment. The amendment would authorize but not require VA to provide deference to veteran patients when resolving disputes regarding primary care provider designations. Number 2, would require the VA to establish procedures to ensure continuity and quality of care while transitioning between providers. And number 3, ensure that VA is able to incorporate values-based productivity models and non-clinical duties such as training or research when establishing performance standards. These changes address concerns raised by VSOs, and I believe that they are reasonable and provide additional clarity and flexibility while preserving the intent of the underlying bill. This really, if you all remember, these were the suggestions that the VSOs made to the bill. Do any other members wish to comment on roll amendment number 1? Ms. Kuster, you're recognized.
Thank you very much, Dr. Rowe. Mr. Chairman, we appreciate your efforts to work across the aisle within this committee and produce a bipartisan effort. For me, this committee is always a breath of fresh air in a very partisan Congress. But I regret to say, unfortunately, I cannot support the proposed pay-for because it does not adequately reflect the needs of our veterans. While this committee is bipartisan and reasonable, the proposals being considered by this Congress turn common sense reform into a partisan fight. To me, it is unfathomable that Congress today, the House today, will vote on a tax cut that will substantially increase our deficit, while we cannot ensure VA health care is fully paid for moving forward. My understanding is the proposed appropriation for VHA as envisioned in this amendment will not adequately cover the costs moving forward. I have to say that the uncertainty of the last year and a half with choice funding constantly running out has been troubling to veterans in my state. We are in the midst of a very difficult and challenging time with regard to the Manchester VA hospital, where Secretary Shulkin is involved. We have a task force that's reviewing access to care. We have all kinds of problems, literally flies in the operating room. We have staffing problems. We have quality of care problems. We have access to care problems. And finally, we have the attention of VA here in D.C., and we are moving forward with a task force, and I'm optimistic that we will improve the quality of care and the access to care in a timely way. But I am troubled that we are going to put choice funding at risk once again on the very day that we're voting. Some people in this committee will be voting to drive up deficits and to give a tax break to the wealthiest Americans. So we should work to ensure that these types of funding uncertainties will not happen again. And I regret to report that I believe this amendment fails to present future fiscal cliffs for veterans' health care. And I yield back.
Thanks, young lady, for yielding. Anyone else wish to speak? I'll just have a couple things to say on that. Number one, we have always provided for our veterans with choice. Not one time has this committee refused to provide choice funds. We've always found those funds. And in the CR we're going to vote on probably tomorrow, there's $2.1 billion in there to finish the rest of the year. So I'll just to say that, and I realize that you all don't like the idea of the tax cuts, but I'm focused today on passing a choice bill that we all worked on, which is a policy-related bill to how we care for our nation's veterans. That's what I'm focused on today. Any other comments on that?
I would just say, Mr. Chairman, I don't think we cannot separate the idea of policy for pay-fors. And again, you're right, we paid for it 6 months at a time when we get to a crisis, and the VA secretary sits in front of us and says, we're going to run out next week. That's not the way to budget. It's not the way to do it. And if all of us are going to whistle past the graveyard that what we do in revenue doesn't matter with the bills, that's how we get to this. I don't disagree with the content. This has been a good piece of legislation working together. But I understand your reluctance to talk about your tax bill. I understand it clearly. But it doesn't mean because you don't want to bring up an unpopular piece of legislation as it ties right to the funding of the bill we're talking about that we can ignore that. The issue on, and we're going to see it in the Senate, we can't pay for veterans' care for the caregivers of World War II. You're right. It's expensive. We can't pay for it because we're going to have to figure out where the revenue comes from. And you're asking us to make the choice between a tax cut or the care that we need here because we are saying there has to be a cap on this. Otherwise, we can't pay for it. And I will remind people, care in the community increased 20% in 2015, not 3%. That's what you're going to be faced with. And I think we could deal with this right now, right here, and have that discussion. I yield back.
I'd be more than glad to take the next hour and discuss this tax bill if you want to, but I'm going to focus right now on the bills in front of us. So any other discussion on my First Amendment?
Mr. Chairman.
Yeah, Mr. Takano, you recognize.
Mr. Chairman, I want to associate myself with the remarks of the ranking member. I admire the work and the spirit in which you try to do this committee's work, but we are coming to a real head here. And in the future, with $1 trillion in deficits spilling over a period of 10 years, we are going to come back and deal with increasing demands to fund choice. We've always, as you said, we've always funded choice, but there's going to be pressure to deal with the fact that we are underfunding the VA itself. We have nearly, depending on who we're talking, what statistic we're talking about, 40,000, 45,000 unfilled positions at the VA, key administrative posts, that leadership posts that aren't being filled. And so every time we get into a debate about or face the challenge of trying to raise enough money to pay for choice, there's a question of are we going to commensurately also fund the VA and its growing needs. So this is going to be a choice that's going to be harder and harder to make in the future, and I don't see how we can separate the course we're putting our country in and the course we're putting our veterans on by the bigger choice that's being made by the Congress today and with this tax bill. So I don't know that we can ignore the tax bill, take this committee's work outside the context of the tax bill. It is in the background. This work is in the foreground. And it's all part of the same picture, the same tableau. And they're together, and I don't see how we can separate the question.
Anyone else wish to speak on this? Mr. Rutherford, you're recognized.
Thank you, Mr. Chairman. I agree with my colleagues across the aisle. We do need to take a moment to talk about tax reform and the importance of that in being able to provide the services not only to our veterans, but to people all over this country. And fact of the matter is, you talk about $1 trillion deficit in this bill, yet if you look at the way the CBO scored it, they showed GDP at 1.9. 1.9. We're currently at 3.2, and that's just in anticipation of the tax reform bill passing. Once this bill passes, I suspect that the GDP will go up even more. Now, here's what's interesting. 1 point in GDP growth is worth $270 billion. $270 billion. So we're looking at $1 trillion deficit, according to the CBO, over 10 years. In the first 4 years, if the GDP remains at 3% plus, that's $270 billion a year. We fill that $1 trillion hole in the first 4 years. Then we have 6 years to take that revenue to do the good things that this committee wants to do for our veterans. And that's why I'm going to be very proud this afternoon to vote for tax reform, because we need the revenue for issues like our veterans. And I yield back.
Thank you, gentlemen, for yielding. Ms. Custer,
Mr.
you're
Chairman,
recognized.
if I could just respond, because I'm interested by your approach, and I think if that's the case, then we should lift the caps. Then what we should be doing today is not this 6 month at a time. What I want you all to understand is happening in my district. There's a task force making a decision right now. We are one of the only states in the country without a full-service hospital. And the decision that's being made is based entirely upon these cooperative arrangements with our community providers. How much care, what type of care, literally step-by-step, endoscopies, you know, we can get into the details. I think the doctors could do a better job than I could of what the care is that's needed. And is that going to happen inside the four walls of our VA, in which case we're going to need capital improvements, we're going to need decisions, we're going to need staff, or is that going to happen in the community? And you can't make those decisions 6 months at a time. So if you're so confident that this tax break for billionaires is going to stimulate the economy, then let's lift all these caps. I came here to talk about this bill, but if you want to talk about this tax break,
Gentlelady yield.
I would be happy to yield.
Gentlelady yield. Thank you. Mr. Chairman, thank you very much, and thank you for yielding, Ms. Custer. You know what's really amazing is that there's a lot of rhetoric around here about this being a bipartisan committee, and I salute the chairman for keeping it that way. I thought we were supposed to be talking about health care for our veterans, but the ranking member and other folks are bringing the tax cut into this issue. Okay, then we're there. Fine. You know what I'd like folks to say? I'd like folks to go back to our veterans who fought for our country, many of them coming back with very severe wounds, why they don't deserve more of their money in their own pockets. You know, Mr. Chairman, it would be great if Washington could understand that this money is not the government's money. This money that our veterans and other folks around the country is their money. And in Maine that I represent, the rural part of Maine, we have the most honest, hardworking people in this country. They work their fannies off for every dollar they have, and it is their money. It's not the government's money. So you know something, Mr. Chairman? We're talking about taxes here. I think it is a great idea that our veterans and our civilians keep more of their money. And this bill that we're voting on today will do this. It's very pro-growth. It's very pro-family. Tell me how you go to a veteran and say, you know something? This tax bill will give you $24,000, the first $24,000 of your income if you're a mom and dad filing jointly, tax-free. Tell me, Mr. Chairman, why someone thinks that's a bad idea. And you know also, Mr. Chairman, the fact, Mike, you need a cough drop. The other thing is that we now have increased our tax credits for our kids from $1,000 to $2,000 a year. What if you're a veteran and you got 3 kids? $6,000 for your 3 kids, a direct tax credit right off the liability you owe the federal government. I happen to think that's a good thing for our veterans. So let's give our veterans a tax cut, like everybody else, but I'm sorry the ranking member and other folks had to get us into this because we're talking, I thought, about health care for our veterans. I yield back.
Thank you, gentlemen, for yielding. I will point out one thing, and I want to get this back on track because we're going to have to vote here in a minute, but I remember the argument I had when I got this pen, which was the first year I showed up here, which was 2009. We were in a recession, and so we needed to spend $800+ billion of government money deciding how it was spent to stimulate the economy. But when we cut taxes for people and allow them to keep their own money and spend it, somehow that doesn't stimulate the economy. I don't understand quite the logic, because I heard that logic 8 years ago, 9 years ago. And if you leave people their money and you look at the 1986 Reagan tax cuts, you look at the capital gains tax cuts that occurred and also during the Clinton administration and the Bush administration, revenue went up. And that's the whole point, is for get the tax rate as low as you can get it and get revenues to government to go up. I think that's what our idea is. Other people believe, and I'll just tell you on the caps and things we're talking about. I didn't look at the CBO score because I can barely follow how they think. But I do know this. I know we spent $9 billion last year on the 6 programs, non-choice programs for care, clinical care in the community. We spent about $3.5 billion on choice. I realize I went to school for 23 years, never did attend a private university. This is all public. I got to add 9 and 3.5, and I got $12.5 billion. And I know next year we're going to go up some probably because there will be some more care. And by the way, anybody who is seeing the VA now has what the ACA defined as adequate coverage. So if they're in VA care, they're eligible, they're there now. You're not going to see an influx of people. And by the way, Mr. DeCon, I'm going to finish. In my district, half as many people pay the penalty as get a subsidy. I just looked up the Kaiser Family Foundation numbers. I wasn't going to go into all this, but since you opened it up, I will. Almost as many people in this nation pay the penalty, pay a fee to buy something they can't afford, than get a subsidy to help pay for something. That's how it is right now. We need to work on this together and help fix this for people. That's not the discussion today. I'm trying to get back to 4242, which is a policy discussion based on how we provide care for our veterans. That's what this hearing is today. Mr. Peters, you're recognized.
Yeah, I understand that you're interested in moving on from this debate. It does, the tax bill today, though, is part of this discussion, because every single independent analysis says that this tax bill will grow our debt faster than it will grow our economy. There will be some economic growth. But if you look at what the Wharton School's dynamic analysis says, after growth and after debt, we're going to go from 77%, debt being 77% of our GDP today, to over 100%. So what I would say to veterans, Mr. Poliquin, my friend from Maine, is I don't need a tax cut. They're going to reduce my tax rate from 36.5 to 36.5 down to, I don't know, something else, something I don't need. I'm proud to pay my taxes to fund these programs here for my veterans. And the fact that 80% of the benefit goes to the highest income people, we didn't have to do that. We don't have to do that even today. So I would say, we all pitch in as Americans to fund these programs, to fund our national defense. And on the theory that every dollar is my dollar, I could take every dollar home and not pay a dime in taxes, which I think some people unfortunately aspire to do. So I'm willing to talk about this, but I had to respond to some of this, what I think is ideological and practical.
Gentleman, yield.
No, I'm not done. And I would say, I would just say that I think what's happened today is particularly unfortunate in that I know the frustration that the other side felt over the health care bill. But this was much less bipartisan even than that. We never had a chance to have a conversation about how to reduce corporate rates, how to deal with international taxation, which speaking for myself, I would have been eager to do, without breaking the bank, without mortgaging our children's future, without adding, by all accounts, from Moody's to Goldman Sachs, slow growth, short-term growth, long-term debt. And I think it's unfortunate. I'll yield the rest of my time to Mr. Walz.
And thank you on this. And I'd remind the majority, everybody at this dais on the majority side voted to repeal the Work Opportunity Tax Credit, the Hire More Heroes Act, and voted to repeal the disability deduction that Paralyzed Veterans of America says is absolutely unconscionable. So keep in mind, to try and separate this, it cannot be separated. This is a moral document about the reflection of our values, and there is not going to be the capacity to care for our veterans because of the choice we're going to be made. I yield back.
Dr. Wenstrup.
Thank you. Just keep in mind, if you want to pay more taxes, you can always pay more. But also, what I would like to I have a point of order. Are we on amendment number 1 or number 2? We're on amendment number 1.
Still, yes.
Okay. I just wanted to be sure. The conversation didn't really sound like it. So.
I thank the gentleman. Mr. Pollak, you've already been recognized in this.
Dr. O'Rourke.
Yes, O'Rourke.
And with all due respect to my very good friend from Ohio, each time a member from the other side of the committee reminds us to get back on track with the amendment at hand, they take great pains to defend the tax bill that we're about to vote on and talk about the virtues of cutting taxes and having those tax cuts flow to the very wealthiest in this country. And I really believe this, and I may take some grief from my side. I think reasonable people can disagree about this, and you're just as good an American as I am if you vote for this and I vote against it. And I think we can have a rational debate about this. There are some things, though, that I think in this tax bill that affect veterans are beyond debate. We know that there will be a 1.4% excise tax on certain nonprofit private university endowments that are used to contribute to the success of the post-9/11 GI Bill. And so you've got the Yellow Ribbon Program. The government provides those matching contributions. Folks who are looking at this are arguing if those endowments are jeopardized, schools are going to back out from contributing to the voluntary Yellow Ribbon Program. When we go to the child tax credit in Texas, from my colleague from Texas, 53,000 Texas veteran parents and working families will not receive the full $2,000 child tax credit, over 500,000 veterans across the United States. And to the ranking member's point, look, there's bipartisan consensus on the virtues of this choice program and standardizing and streamlining and effectively coordinating care. I love the fact that the primary care physician is going to be at the VA and care for the veteran will be coordinated out of the VA, and those conditions unique to service and combat will be treated at the VA where they should. And I'm grateful for the work that all members of this committee and the majority and the minority staff and the veteran service organizations put into it. But to the ranking member's point, we've got to be able to pay for this stuff, and there has to be predictability in our budgets, because when there is not, those who pay are the veterans. And it is the secretary who comes up scraping and begging, asking us for money. It is the programs, to my colleague from New Hampshire's point, that cannot plan, cannot program, cannot fund capital projects. And this is no way to run a country or to run a VA or to serve our veterans. One approach that I've taken, I would welcome any of my colleagues to join me. I wrote a bill to fund the wars that we fight and pay for them as we wage them. Right now, they go on the federal credit card, and we never have the resources. You know, the chairman mentions 50 freaking years of not recognizing blue water Navy veterans in Vietnam for presumptive exposure to Agent Orange. It took this country 40 years to acknowledge the exposure to Agent Orange for those service members who set foot in Vietnam. 26 years, to Ms. Estes' point, after the Gulf War, we are still not recognizing Gulf War syndrome. And for those who've been exposed right now to chemical burn pits in Iraq and Afghanistan, we don't have the resources. I joined two Republican colleagues, Mr. Young of Alaska, Mr. Jones of North Carolina. I joined a Marine combat veteran, Seth Moulton of Massachusetts, to introduce this bill that would generate $22 billion a year to fulfill our commitments to those who have borne the battle. So we, I think, agree on the policy. Let's get together on the pay for it. I've offered my way to do this. If you have a better one, I'm all ears and I'm ready to work for you. But let's not set this up for failure by passing this today without a way to ensure that we can fulfill our commitments. With that, I yield back.
I will point out to the members, and about four of us that have been here since 2009, the budget was $93.5 billion in 2009. This year's budget is one for the VA, all VA care. That's disability, health care, and cemeteries. This year's budget's $186.5 billion. It's a doubling of the budget in 9 years. Anyone else wish to speak?
Mr. Chairman?
Let me see if anyone on our side goes. Okay, Ms. Brownlee.
Thank you, Mr. Chairman, and I would just like to also associate my remarks from my friend from Texas here on this side of the aisle. I think it's impossible to separate the issues around the tax debate and properly funding the VA and coming up with the right pay-fors. I really do believe that we've got the policy. We're close to getting the policy right on this bill, and I think everyone on this committee wants the VA to be an agency of excellence and making sure that our veterans have the the proper health care and all the other benefits that they have earned and deserved. An analysis today said that 83% of the tax benefit will go to 1.2 million homes in America, and the rest, that 17%, that rest will go to the rest of the households and will trickle down to the rest of those households. And I think if we just took a tiny, tiny bit of that and put it towards properly funding the VA, we could really get to this place that we all want to get to in terms of an agency of real excellence, and the research that we need to do, the manpower that we need to properly serve our veterans. And we're going to vote on this, in a couple of hours. And, this is our last shot. And if the will is there, we know that we can do it. The resources are there. I think the tax bill actually sunshines all of those, what the possibilities are in terms of what we can do for our veterans. And I just think we need to do the right thing. And if the will is there, we can do it. And I yield back.
I think the ranking member's already spoken on this. I'm gonna
Mr. Chairman, we got a history of decorum here.
We
I don't
do,
abuse
but
this.
and
I do not abuse it.
And we've spoken. This is about a VSO. These 3 points that VSO's made to improve the Choice Act bill. That's what this amendment, my amendment, is. If anybody has any more discussion on that, I'm all ears.
This decision will set a precedence that's hard to come back from.
I'm all ears. If you're wishing to speak on my amendment.
So there are rules now that will be given at this time that will dictate how we interact on this. Because keeping in mind, none of us had any opportunity to discuss this pay-for before. We never had any opportunity to discuss this tax bill. So it's your call as the chairman if the ranking member is allowed to speak or not.
You've already spoken 3 times on this bill. So
and that's in our rules that there's a limit to the ranking member's amount of time.
No, I think what we usually do is recognize someone for 5 minutes and you speak. And that's the way we typically have done it, I think.
We all know there's institutional decorum that goes. I will respect your opinion on that, but I think what you recognize is that changes the institution and changes this committee if you choose to make that decision that the ranking member is limited.
Ms. Rice.
Thank you, Mr. Chairman. I yield my time to the ranking member.
Keep in mind, we have not had a single opportunity of any of us. You may get the opportunity to find out what it's like to be on this side. And what I can tell you is we have fought hard to not make that the case. I see you as colleagues. I see you as partners. I see you as fellow Americans and friends in here of trying to make the case on this. We are not ripping into the tax bill because ideologically we're opposed to it. We think it ties directly to this. And the only comment I was going to make, the chairman is right, and I thank him for the increases to the budget to the VA. I am with him that if some of that money is not being spent correctly, we need to be the watchdogs on it. That's not it. My point I was going to remind you of before I came to Congress, in 2005, I remind some of you here, we had a budget crisis under the second previous administration prior to the Obama administration where we so poorly budgeted, the decision was made to cut off Priority 8 veterans from VA services. To make the budget work, we just lopped off millions of veterans and said you're no longer eligible and change the eligibility rules. And the chairman brings up the point that we have increased funding to the VA at the rate he says since 2009. I would remind the chairman that we have been at war for 9 years and 1 million Americans have entered the war zone since that time. Mr. O'Rourke's point is that comes at a cost. I thank the gentlelady from New York for yielding the time, and I would like to think that all of us in here have not lost sight of this is one of the last bastions where we can have open and honest debate, sharing shared values and trying to disagree on the points that we think are relevant. Every single one of you will get the opportunity to come back here when that rate rises above 3% and deal with it. That is unavoidable, and I just ask you to start thinking about that.
Thank you, gentlemen, for yielding. Any other comments on the Roe Amendment number 1? Okay, hearing none, I have a second amendment to the desk. However, after conferring with our VSO partners and hearing their concerns over an authorization cap included in my second amendment, I've decided to withdraw it from consideration this morning. Although these caps come from VA's own projected need for 2019, I understand the VSO's concerns about placing a cap on authorization levels, especially given VA's track record of poor financial forecasting, as Ms. Brownlee has pointed out. Thank our VSO partners for providing their feedback, and we now shall proceed with roll amendment number 3. The clerk shall report roll amendment number 3.
An amendment to H.R. 4242.
Okay, I ask unanimous consent that the reading be dispensed with. Hearing no objection, I now recognize myself for 5 minutes. This amendment would authorize the establishment of a Center for Innovation for Care and Payment, which would develop new and innovative pilot programs designed to improve payment and delivery models while preserving or enhancing the quality of care furnished by VA. VA is an industry leader in training and developing the next generation of American doctors. VA is an industry leader in developing new and innovative drugs to save the lives of countless individuals worldwide, like hepatitis C drugs. Why shouldn't VA be an industry leader in efficient and innovative payment and quality models of healthcare delivery? This amendment provides an opportunity to explore avenues for potential excellence. We have watched the VA budget explode over the past years, and many of us have fielded repeated calls from our constituent providers about not being paid on time, if at all. This pattern cannot be sustained. This provision, which the administration requested, would give the Secretary the means to develop and test payment and service delivery models designed to reduce costs and improve care, and I urge my colleagues to support my third amendment. Do any other members wish to comment on my third amendment to H.R. 4242? Mr. Walls, you recognize.
Thank you, Mr. Chairman. While I have my concerns on this, I will withdraw those concerns. And I would just ask a point of clarification. By withdrawing your second amendment, is it correct for us to understand that the 3% payment cap has been lifted?
I support the second amendment, but my second amendment I withdraw.
Thank you. So the second amendment to this. So I just want to clarify for the folks here that by withdrawing this amendment, it was given to us, and we had not known that you were going to withdraw and assumed there would be a vote based on party line vote. So you are going to withdraw it, acknowledging that that cap is now no longer, the 3% is no longer there.
I think, would the gentleman yield?
Yes.
I think that the caps discussion broke down before Thanksgiving when both sides, our leadership, began to debate this. Until that's worked out, I don't think we can come up with a cap until they've worked out the top line caps.
Okay. Okay. Yeah, well, it changes the debate of where we're having. This changes the debate. There's still the discussion, and we will go on today on how do you pay for this. But I appreciate the chairman on this. I appreciate the recognition of that. I wish we'd have had that discussion 5 minutes before what happened. I think it would have been very helpful, but we'll continue on. I thank the chairman. I yield back.
Thank the gentleman for yielding. Anyone else wish to discuss my amendment number 3? I now understand Mr. Takano has an amendment at the desk. Clerk shall report Takano amendment number 1.
An amendment to H.R.
I ask
4242.
unanimous consent that the formal reading of the amendment be dispensed with. Hearing no objection, so ordered. Mr. Takano, you now recognize for 5 minutes to speak in support of your first amendment.
Thank you, Mr. Chairman. Through Veterans Care agreements, the VA provides billions of dollars in taxpayer funding to private providers who treat veterans through community care programs. Given the size and importance of those contracts, it only makes sense that these providers be held to the same federal contracting standards that apply to every other organization that does business with the federal government. My amendment simply states that veteran care agreements should be subject to the same federal acquisition regulations as any other federal government contract. When the federal government contracts with a private company, it does more than simply exchange funds for services. It sends a message to the public about the type of business practices that taxpayers endorse. Ensuring that community care providers are forced into a competitive process and that they live up to principles such as equal employment and non-discrimination, it is vital to protecting the integrity of community care programs and upholding our commitment to treating all individuals with dignity and respect. Before yielding back, Mr. Chairman, I want to echo some of the ranking member's concerns about the underlying legislation today. As the ranking member said in his opening statement, we are no longer talking about, initially we were talking about the 3% authorization cap, but we still have this problem of a pay-for. We still have a problem of long-term sustainability, and I still think we're going to be facing stopgap funding bills that are subject to the same uncertainty that we face today under the Choice program. The annual growth rate in the cost of community care has consistently exceeded 3%. In fact, my ranking member has said 20% by the budget report over the year 2015. And that's not counting the costs that we will experience due to the automatic cuts that are due to Medicare. And how does Medicare impact VA? Well, many Medicare recipients are also beneficiaries, also qualify for the VA. If their costs go up because of budget pressures in the future, that will drive more of those veterans to come to the VA for their operations and for their care. And certainly we can expect that pressure will be put on expanded Medicaid. 1.7 million of our veterans rely on expanded Medicaid. And if we see the Medicaid funding cut due to the deficits that we are going to contend with over the next 10 years, we can expect those veterans to come and rely on the VA more and more. And these are the ways in which we can see VA, the pressure for both the Choice and the core VA funding to be impacted. So we know that these tax cuts are going to impact us through a domino effect. Squeezing Medicare and squeezing Medicaid will then, I think, force more veterans to come and get their care and make the choices to seek the care that they deserve and are entitled to at the VA. In addition, the costs associated with expanding care in the community should be a concern that, for everyone on this committee. Thus far, our commitment to filling funding gaps in veteran health care has been unconditional. However, as costs continue to rise, as mounting deficits put pressure on the deficit, a deficit that the CBO projects to be about $1 trillion in the next 10 years, we must consider the long-term sustainability of these programs. In 5 or 10 years, facing deficits are at least $1 trillion higher because of this tax bill, we will start facing some difficult choices. And I fear that veterans will ultimately pay the price, and I mean in a very literal sense. If we wait until we are confronted with those choices, it will be far too late. I'm struck by the glaring contradiction, We are underfunding veteran health care, while the majority is passing a tax bill that overwhelmingly benefits the very wealthy at the expense of the middle class. And veterans are very much the middle class. They earn an average of $40,000 a year. And this tax bill hurts the middle class. It will hurt our veterans directly, and it will hurt veteran care. I yield back, Mr. Chairman.
Thank you, gentlemen, for yielding. Anyone else wish to speak? I will not, thank you, Mr. Takano, I will not be supporting this amendment. This amendment would subject provider agreements to all aspects of the Federal Acquisition Regulation, or FAR, prevent the Secretary from waiving any provision of the FAR that does not specifically mention a waiver, and in particular makes providers follow cost accounting standards issued by the Federal Cost Accounting Standards Board. One of my concerns about this is I have been a provider for VA patients. If you make this so complicated and you're seeing 10, 15 people a year, you're just not going to see them. You're not going to do it. You're not going to fool with it to see those few people. So that's one concern I have as a provider. Provider agreements are a simplified mechanism modeled on Medicare's provider agreements for small community providers treating a limited number of veterans. The agreements supplement the community care network when such small providers are constrained in being able to handle the administrative burden of joining the network. Provider agreements were originally authorized in the Choice Act. Permanent legislative authority to continue them was one of the Obama administration's top VA priorities last year, and VA continues to stress their importance. This amendment appears to undermine the provider agreement's rationale and purpose, and for that reason, I will be opposing it. Do any other members wish to speak on Mr. Takano's First Amendment to H.R. 4242? I understand Mr. Takano has another amendment at the desk. Clerk shall report Takano Amendment Number 2.
An amendment to H.R.
I ask
4242.
unanimous consent that the formal reading of the amendment be dispensed with. Hearing no objection, so ordered. Mr. Takano, you're now recognized for 5 minutes to speak in support of your second amendment.
Thank you, Mr. Chairman. The single most important thing we can do to improve the quality of care at the VA is to fill the tens of thousands of vacancies at facilities across the country. My amendment seeks to accomplish that goal by setting a minimum VA staffing level that must be reached by September 30th, 2019, for the VA to fully utilize its appropriate funding in the following fiscal year. This provision would refocus the VA's efforts on hiring talented and dedicated employees who will help the agency succeed in its vital mission to serve veterans. Mr. Chairman, years of chronic underfunding and understaffing have created many of the problems we are working to address today. Unacceptably long wait times, limited access to specialists, and lapses in leadership at medical facilities can all be tied to vacancies at key roles in the agency. I strongly believe that our oversight role must be used to encourage VA to put more effort into hiring and retaining talented employees. And that is what my amendment would do. And I really don't want to hear that we can't afford to fill the vacancies at the VA because at the moment we are cutting revenue to the government with the tax bill that we're voting on. I ask my colleagues to support this amendment, and I yield back the balance of my time.
I thank the gentleman for yielding. I will not be supporting this amendment. I certainly understand the intent of this amendment and agree that VA has staffing shortages across the system. But I do not agree that the VA is underfunded. We've had the Secretary sit right there at that table and say money was not the problem. And certainly, Ms. Custer pointed out some issues in New Hampshire that are not money related, they're leadership related. If you have the proper leadership, I don't believe you'll have that problem. So the Secretary says he has enough money to carry out his mission. And in fact, through the Public Law 1546, the VA Choice and Quality Improvement Act of 2017, this committee has recently provided VA with additional direct hire authority needed to fill critical vacancies in both clinical and non-clinical roles. But rather than pushing forward with additional laws to prescribe mandatory staffing levels, I'd like to offer to work closely with the gentleman from California on our continued oversight role in the application of this new authority that the VA has and demand that VA more accurately identify workforce requirements, increase transparency with regards to employee shortages, and provide this committee with the information needed to assist in making sure that VA employees indeed possess the qualities needed to best serve our veterans. Do any other members wish to speak on Mr. Takano's second amendment? Hearing none, I understand Mr. Takano has a third amendment at the desk. The clerk shall report Takano Amendment Number 3.
An amendment to H.R.
I ask
4240.
unanimous consent that the formal reading of the amendment be dispensed with, and hearing no objection, so ordered. Mr. Takano, you're now recognized for 5 minutes to speak in support of your third amendment.
Thank you, Mr. Chairman. The Veterans Health Administration is held to incredibly high standards for transparency and accountability. These standards are critical for uncovering and correcting performance issues at the VA and to ensuring veterans consistently receive quality care in a timely manner. The private health care providers that treat veterans through community care programs are not subject to those very same standards. The lack of accountability and oversight in non-VA facilities is problematic for a couple of reasons. First, it significantly undermines our ability to maintain proper oversight over veterans' care and take action when issues arise. And second, it has the potential of masking fraud and abuse that affects the financial stability of the system and wastes taxpayer dollars. My amendment would address this gap in oversight by establishing the Office of Non-VA Medical Care Accountability. This office would ensure that those providing care to our veterans and receiving taxpayer dollars are subject to strong accountability standards, whether that care takes place inside or outside a VA facility. The office would be led by an assistant secretary nominated by the President, who would advise the secretary on all matters related to non-VA care. Under my amendment, the office would be empowered to investigate allegations of malpractice, negligence, or fraud at non-VA facilities and recommend corrective action. work with the Office of Audits as well as the Office of Investigation to review the use of funds and the quality of care at non-VA providers, and to issue reports and recommendations to improve the quality and oversight of non-VA care. Now, our ability to conduct thorough oversight of veterans' care should not be restricted by those who provide that care, whether we're talking about a VA provider or a community care provider. We must have the ability to identify and address underperformance. Earlier this year, the VA Inspector General released a report finding that veterans receiving care through the CHOICE program are at greater risk of opioid abuse in the treatment of chronic pain. And this is because the community providers were not subject to the same guidelines that VA providers are required to follow, and because of breakdowns in communication between VA and non-VA facilities. Now, these are the types of issues that my amendment could address. There is too much we don't know about the success of community care programs in treating the unique conditions that veterans face. By creating an office that is dedicated to monitoring quality at community providers, we can establish more consistent oversight on behalf of veterans and taxpayers. As the role of community care expands, it would be irresponsible for us not to expand accountability accordingly. I encourage members of the committee to support this amendment, and I yield back the balance of my time.
I thank the gentleman for yielding. I will not be supporting this amendment. I do, however, believe VA must have an empowered point person whose job is to provide accountability and oversight to all aspects of both VA and non-VA care. For this reason, we created the Office of Accountability and Whistleblower Protections within Public Law 11541, the Department of Veterans Affairs Accountability and Whistleblower Protection Act of 2017. We voted on that last April, I believe it was. I would like to work with the gentleman moving forward to ensure this new position is following the intent of that legislation and that VA has the information it needs to provide a strong and accountable community network. Let me share some of my frustrations after going to a few of these facilities, Mr. Takano, is that I went to a dialysis center not long ago that took care of veteran patients. They couldn't, the VA was not sending them any records, any information. So you're out there and you're basically flying by the seat of your pants. You're the provider, this veteran shows up, you have no information to treat that veteran, and we're going to begin to implement a very complicated interoperative electronic health record. That is going to be absolutely key to being able to provide the quality of care that you're looking for. I think that is absolutely key. Number two, in our bill that we're going to vote on a little later today, we have a case manager both for inside VA and outside VA care. That's in the bill. So I think, and Mr. Kaufman's bill that we just voted on block will reach those concerns that you have on opioids, and I certainly share those concerns. Does anyone else wish to speak on the bill? I know we've got to go vote here in just a minute. Ms. Custer, you're recognized.
Thank you, Dr. Rowe. I wanted to call up the Custer Amendment to H.R. 4242. Is this, sorry, I'm so sorry.
We're still discussing.
My mistake.
Yeah, that's okay. That's irrational exuberance. I like that. Does anyone else wish to speak on, seeing none, then we'll bring up, now that she's brought it up, Ms. Custer's amendment is at the desk. The clerk shall report.
An amendment to H.R. 4242 offered
Ask
by...
unanimous consent that the formal reading of the amendment be dispensed with. Hearing no objection, so ordered. Ms. Custer, you're now recognized for 5 minutes to speak in support of your amendment.
Thank you, Mr. Chairman. And I want to say that I appreciate the discussion we had, and I very much appreciate your withdrawal of your Second Amendment today. So thank you for that. My amendment to H.R. 4242 would ensure that the successor to the CHOICE program would account for those states that lack a full-service hospital. In 2014, when Congress came together in a show of bipartisan support, it provided specific eligibility rules for states like my home state of New Hampshire. As I previously discussed with this committee, the Manchester VA Medical Center is now in the news. The allegations of Manchester whistleblowers are serious and demonstrate the need for increased flexibility for veterans in New Hampshire. I'm thankful to Secretary Shulkin, who joined me in taking action on correcting the situation in Manchester. The Secretary removed the Director and Chief of Staff and created a task force to seek improvements to the facility. And I want to particularly thank the leadership of my esteemed colleague, General Bergman, who came to New Hampshire to hold field hearings on the situation. Veterans in my state are grateful, and I appreciate your leadership on oversight and investigations. However, these are first steps. The facility does need improvement, and that's why I led the New Hampshire delegation in requesting the construction of improved women's health clinic. After significant complaints from women veterans, the VA has now agreed to this request. However, Manchester will still need a robust community care program to complement the care provided by VA providers. The vast majority of Granite State veterans that use this facility are currently eligible for the CHOICE program. The Manchester facility, because it is not a full-service hospital, relies on the CHOICE program to provide care that our veterans expect and deserve, and that is why my amendment is necessary, because it would instruct the Secretary of the VA to take into special consideration veterans of states without full-service facilities. Our esteemed Senate colleagues overwhelmingly supported an amendment offered by Senator Sullivan of Alaska. I urge my colleagues in the House to support my amendment because it's good policy with significant bipartisan support. The CHOICE program is so valuable to my constituency because it complements the care they deserve. Mr. Chairman and my colleagues in the committee, remember veterans like those in the Granite State when you design these reforms. Thank you, and I yield back.
Thank you, gentlelady, for yielding. I will be supporting this amendment. While the underlying bill is designed to move away from arbitrary triggers to authorize care in the community, I believe this amendment will result in increased access to care for those veterans who live in states without VA medical centers, and for that reason, I support the amendment. Anyone else? I'll go with Mr. Dunn, Dr. Dunn.
Thank you, Mr. Chairman. As a physician, I also would like to say I'm going to be lending my voice to this amendment. I think it's very appropriate, and I thank Ms. Custer for offering it.
Thank you, gentlemen, for yielding. Mr. Takano.
Chairman, just a point of parliamentary inquiry. I just noticed we're not voting on amendments as they arise. I just want to make sure I retain the right for a roll call vote on at least one of my amendments.
Yes, well, there'll be a roll call vote. All the ones that weren't on block will be a roll call vote.
Okay, thank you.
Does anyone else wish to speak? I'm going to adjourn, and we have votes that have been called, and as soon as votes are over, we'll return. Thank you. Meeting will be in order. Are there any members that wish to speak on Ms. Custer's amendment? I recognize anyone. I understand that Ms. Brownlee has an amendment at the desk. Clerk shall report Brownlee Amendment number 1.
An amendment to H.R. 4242 offered.
Unanimous consent that the formal reading of the amendment be dispensed with. Hearing no objection, so ordered. Ms. Brownlee, you now recognized for 5 minutes to speak in support of your amendment.
Thank you, Mr. Chairman. This is an issue we've discussed before, and I appreciate your commitment to finding a long-term solution to the VA's leasing challenges. As we are talking about care in the community and reforming the choice program, we can't overlook the internal needs of the VA. I believe that leasing will play a big role in the future of the VA by bringing more clinics with more specialty care closer to veterans across the country and having that flexibility that we've talked a lot about. We were able to break the logjam earlier this year and authorize 28 new VA clinics across the country, some that had been pending in bureaucratic limbo for years. Bringing these clinics online will help reduce wait times and improve access to care for veterans in 17 states with nearly 12 million veterans living in them. But we need to find a long-term solution to this issue and make sure we're consistently investing in the VA to serve a new generation of veterans. My amendment to H.R. 4242 would fix this problem permanently. Once the VA determines through the strategic capital investment planning process that a new lease is needed in a community, my amendment would allow the House and Senate Veteran Affairs Committee to approve new facilities via committee resolution instead of legislation. This is the process that was previously used by the VA committee, and it is the process that is currently used by the T&I Committee and the General Services Administration for all other federal buildings. This small procedural change will make a big difference in the lives of veterans who are waiting for better access to care. There is simply no excuse for Congress to hold up needed VA clinics because of bureaucratic scoring disputes with CBO. This change is supported by many of the VSOs and was recommended by the Commission on Care. Mr. Chairman, I know that you recognize the scope of this problem, and I want to thank you for your commitment last month to fixing the issue. We can fix the choice program and support other programs critical to VA's mission and my mission and the mission of the members on both sides of the aisle, provide the care our veterans have earned and deserved. The demand for VA health care is increasing, and many veterans who are trying to access VA care face long wait times still and outdated facilities that are too small with too few exam rooms and too few providers. We can help fix that, and we have a responsibility to do so. I urge my colleagues to support this amendment and help ensure veterans get the care they need and to make the investments we need to build a modern, veteran-centric 21st century VA. Thank you, Mr. Chairman, and I yield back.
I thank the gentlelady for yielding back. I will not be supporting this amendment. This committee has revisited this provision several times, and I still do not believe that it's responsible to waive our committee's authorizing authority when considering the approval of major medical facility leases. CBO and I disagree on many things, including the scoring for the underlying bill, and I share Representative Brownlee's desire to find a way to make it easier for us to authorize VA major medical facility leases. Unfortunately, the amendment in question would score at least $1 billion per year in mandatory spending, which is a concern, and this amendment would not address the underlying problem of how these leases are scored. I will continue to work with the gentlelady from California in finding a way forward to prudently authorize these admittedly needed leases. Do any other members wish to comment on Representative Brownlee's first amendment to H.R. 4242? Okay, seeing none, hearing none, that concludes the debate on the amendments. I'll try not to get this too confused.
Because yours is an ANS.
Yes.
So after this, we're going to vote all these, perfect that vote.
Okay. The question now occurs on roll amendment number 1. All in favor say aye. Aye. All opposed say no. The opinion of the chair, the ayes have it. The amendment is agreed to. The question now occurs on Royal Amendment number 3. All those in favor say aye. Aye. All opposed say no. In the opinion of the chair, the ayes have it. The Royal Amendment 3 is agreed to. The question now occurs on Takano Amendment number 2, isn't it? Is it number 1 or 2 that you?
All of them. So 1, 2.
Okay, 1, 2, 3, okay. Question now occurs on Takano Amendment number 1. All those in favor say aye. Aye. All opposed say no. No. In the opinion of the chair, the noes have it. Takano Amendment 1 is not agreed to. The question now occurs on Takano Amendment number 2. All those in favor say aye. Aye. All opposed say no. No. On the
Mr. Chairman,
opinion of the chair,
I request a recorded vote.
a recorded vote is requested. The question now occurs on Takano Amendment number 3.
Let's take the roll.
I'll take the roll call vote now, okay. I will call, the clerk will call the roll.
Dr. Rowe.
No.
Dr. Rowe votes no. Mr. Bilirakis. Mr. Bilirakis votes no. Mr. Kaufman. Mr. Kaufman votes no. Dr. Wenstrup. Dr. Wenstrup votes no. Ms. Radewagen. Ms. Radewagen votes no. Mr. Bost. Mr. Bost votes no. Mr. Poliquin. Mr. Poliquin votes no. Dr. Dunn. Dr. Dunn votes no. Mr. Arrington. Mr. Arrington votes no. Mr. Rutherford. Mr. Rutherford votes no. Mr. Higgins. Mr. Higgins votes no. Mr. Bergman. Mr. Bergman votes no. Mr. Banks. Mr. Banks votes no. Ms. Gonzalez-Colon. Mr. Waltz. Mr. Waltz votes aye. Mr. Takano. Mr. Takano votes aye. Ms. Brownlee. Ms. Brownlee votes aye. Ms. Custer. Ms. Custer votes aye. Mr. O'Rourke. Mr. O'Rourke votes aye. Ms. Rice. Ms. Rice votes aye. Mr. Correa. Mr. Correa votes aye. Mr. Sablon. Ms. Esty. Ms. Esty votes aye. Mr. Peters.
I'll let them record it.
Mr. Chairman, the vote is 14 yeas and 8 noes. I'm sorry. 13 yeas and 8 noes.
That's incorrect. It's backwards.
No, it's backwards, I think.
I'm sorry, the chairman, the vote is 13 noes and 8 yeas.
Thank you. The amendment's not agreed to, and those who are not here, since it won't change the vote, can vote if they arrive. I think we can do that. The question now occurs on Takano Amendment number 3. All those in favor say aye. Aye. All opposed say no. No. In the opinion of the chair, the noes have it, and the Takano Amendment 3 is not agreed to. The question now occurs on the Custer Amendment. All those in favor say aye. Aye. All opposed say no. In the opinion of the chair, the ayes have it, and the Custer Amendment is agreed to. The question now occurs on Brownlee Amendment number 1. All those in favor say aye. All
Mr.
opposed-
Chairman, I'd like to request a recorded vote.
A recorded vote's been requested. Clerk, call the roll.
Dr. Rowe.
No.
Dr. Rowe votes no. Mr. Bilirakis. No. Mr. Bilirakis votes no. Mr. Kaufman. No. Mr. Kaufman votes no. Dr. Wenstrup. Dr. Wenstrup votes no. Ms. Radewagen. Ms. Radewagen votes no. Mr. Bost. Mr. Bost votes no. Mr. Poliquin. Mr. Poliquin votes no. Dr. Dunn. Dr. Dunn votes no. Mr. Arrington. Mr. Arrington votes no. Mr. Rutherford. Mr. Rutherford votes no. Mr. Higgins? Mr. Higgins votes no. Mr. Bergman? Mr. Bergman votes no. Mr. Banks? Mr. Banks votes no. Ms. Gonzalez-Colon? Ms. Gonzalez-Colon votes no. Mr. Waltz?
Aye.
Mr. Waltz votes aye. Mr. Takano? Mr. Takano votes aye. Ms. Brownlee? Ms. Brownlee votes aye. Ms. Custer? Ms. Custer votes aye. Mr. O'Rourke? Mr. O'Rourke votes aye. Ms. Rice? Ms. Rice votes aye. Mr. Correa? Mr. Correa votes aye. Mr. Sablan? Ms. Esty? Ms. Esty votes aye. Mr. Peters? Mr. Chairman, the vote is 14 noes and 8 yeas.
How is Mr. Peters recorded?
Mr. Peters is not recorded. Mr. Peters? Yes. Mr. Peters votes aye.
Okay. Mr. Peters is recorded as a yes. I was going to record that for you. You didn't.
Mr. Chairman, the vote is 9 yeas and 14 noes.
The amendment is not agreed to. We now move on to our final amendment, an amendment in the nature of a substitute to H.R. 4242 offered by Ranking Member Walls, which is at the desk. Clerk shall report.
An amendment in the nature of a substitute to H.R.
Ask unanimous
4242.
consent that the formal reading of the amendment be dispensed with. Hearing no objection, so ordered. Ranking Member Walls is now recognized for 5 minutes to speak in support of his amendment in the nature of a substitute.
Well, thank you, Mr. Chairman. And again, this is our opportunity to try and bipartisanly work on a bill. My friend from Ohio made the suggestion and said, had you been allowed to enter an amendment on the House floor, would you have supported the tax bill? And no, and I wasn't speaking disingenuously. When you're in the minority and something like this happens, I wanted to take a terrifically horrendous bill and make it just stunningly horrendous by improving on it slightly, and then, of course, you can vote no. But it would have left here better, in my opinion, and that's many times what the role of the minority is. So in this case, this is, the base of this ANS is the Senate amended version. You will see it again. Trust me, you will see it again. I thought it is important, though, to maintain the eligibility criteria outlined in H.R. 4242. Not only was that developed by all of us in a bipartisan manner, but the outline simplified the circumstance in which a veteran could receive care in the community. The latter point is critically important. We've heard from countless veterans, providers, and VA staff regarding the complex nature of operating care in the community through 6 separate programs. Streamlining that eligibility for hospital care, medical services, and extended care into one program has been a stated goal of this committee for a long time. The eligibility criteria are one of the most important parts of future care in the community. I was disappointed to see that despite a thoughtful legislative proposal from the VSO community to clarify provisions surrounding eligibility, folks decided that the suggestion and were afraid of controlling unfettered choice might displease factions within inside the administration who have influenced a lot of this legislation. That's why I felt it was vital to incorporate the proposed changes that the real and the broader VSO community raised. In addition to addressing the future of community care, the Senate amended version includes $1 billion to enhance internal capacity at the VA through provisions such as improving graduate medical education, residency, telemedicine, and a pilot program increasing the use of medical scribes. All things that the physicians on here brought up, and you're absolutely right. Senate language includes a bipartisan provision to expand the family caregiver program to all areas of veterans and the caregivers. Again, I get it. Limiting eligibility of the program to caregivers, which many of us championed in here, created an inequity. And it's simply up to us. But the decision is today, we're going to say, you're right, we should fix that, but we can't pay for it. We just came from the floor that said, we've got too much money here, we got to give it back. So it's a choice. I hope my colleagues support this measure, and I yield back, Mr. Chairman.
Thank you, gentlemen, for yielding, and I will not be supporting this amendment in the nature of a substitute to H.R. 4242. This substitute amendment is, in essence, largely the Senate bill reported out of their committee earlier this month. Not only does this amendment go beyond the scope of reforming the choice program, it has a significant preliminary CBO score of nearly 60 billion, with one provision costing tens of billions more because of costs that will be incurred after 5 years. This is a proposal that is unlikely to be accepted in the Senate, let alone the House. I would like to remind everyone what Ranking Member Walls said during the markup of the asset review on November 8th, H.R. 4242. I think all of us know what the gorilla in the room on this is. And the only reason we're not taking up 4242 today is the cost. And I think that's a pretty big gorilla. If the cost of H.R. 4242 was the gorilla in the room in November, then Ranking Member Walz's amendment in the nature of a substitute is King Kong. I find it unsettling that Ranking Member Walz would offer this amendment and walk away from the bill that the committee worked so hard on to achieve bipartisan support, as evidenced by every member of this committee signing on as an original co-sponsor. And for those reasons, I cannot support the amendment in the nature of a substitute. And I do appreciate, I truly do appreciate, and as I said, when I started out in this seat right here as the chair, I wanted to be sure that every member of this committee had input, every single one. I don't care if it was a person who's a freshman member who just came here. They came here with ideas, and many of them good ideas. We were, after meeting with the secretary, with the VSOs, and with every member here in roundtables and hearings, and then privately, we put together which I think we're going to vote on in just a minute, an excellent bill. And I think one that everyone in this room can be proud of, and one that focused exactly what they told me the VA wanted, and mission that they wanted was to focus on how we provided care, non-VA care. We set up a program where you have a gatekeeper, just like your private health insurance plan probably has. If that didn't work, we had ideas where veterans could change their PAC team provider or seek VA care out of there. And since this year has gone on, I've traveled from East Coast to West Coast to multiple VA facilities, both large urban areas and small rural areas, to find out what those concerns really are. And I've had town halls with veterans at every single stop along the way, stopped and listened to those veterans and what they needed. And we tried to thread the needle and get the needs both in rural areas. We passed a telehealth bill in this committee. Opioids are a huge issue. We've addressed those medical issues that I think we needed to in the bill. And I think there are provisions in the Senate bill that we should look at as a standalone. Just like Ms. Esty, we talked to her. Those are big issues. They don't need to be a footnote in a health care bill. They need to be standalone bills, as I think the caregiver needs to be fully debated and discussed and listened to and bring people in here. I think we absolutely need to do that, and I plan to do that next year with your support. So I will seek any other input from members. Anyone else wish to speak on the amendment nature for substitute? Mr. Takano, you're recognized for 5 minutes.
Well, I support the elements that are in the amendment in nature of substitute, which largely mirrors the bill passed out of a committee led by Senator Isaacson. And I want to return us back to the fundamental truth of the situation, that we are making choices. We are making choices with a vote that the Congress is taking today on the tax bill. And we are saying that we need to return much more money to the wealthiest people in this country, the wealthiest corporations, and it's coming out of the hide of the middle class, and very pointedly, it's coming out of the hide of our nation's veterans. We have not been fully clear to the American people about the total cost of going to war in this country. We've had 1 million veterans, 1 million service members who've participated in this war. I recall during World War II, I wasn't around in World War II, but I recall the history of World War II. Victory Gardens were built by homes all across this country. We saw tax rates, the highest we've seen ever in our country's history, the tax rates on the wealthiest of this country and on the corporations. There was a sense that if we are going to war, we go to war as a nation. But we contrast that with how we approach paying for war and paying for the effects of war today. We are cutting taxes, and we are putting the burden on those who serve our nation. And make no mistake about it, that's the choice that we're making today. I support the ranking member's amendment in the nature of a substitute. I think we need to have an honest discussion about how we're going to pay for veteran care going on a 10-year time horizon and beyond. What this tax bill does is it puts some sugar up front that diminishes and disappears and actually becomes a negative effect on the middle class of this country after 10 years. What we're saying also is that for veterans care, we're seeing the same sort of problems if we don't confront the budgetary straitjacket we're going to put on veterans care over the next decade. And I strongly urge us to consider and support the ranking member's amendment.
Thank you, gentlemen, for yielding. Anyone else wish to speak? Mr. Paulquin, you're recognized.
Yes. Thank you, Mr. Chairman. I would just like to remind everybody on both sides of the aisle that those of us who have run small businesses in our careers before coming here, that when you reduce the cost of doing business, whether it's lowering taxes or lowering energy costs or making sure trade is fair or make sure you remove expensive and redundant regulations, when you lower the cost of doing business, a couple things happen. First of all, the economy grows, and businesses have more money in their pockets. And when they have more money in their pockets, they don't run away with it or put it underneath the mattress. They reinvest it in their businesses. And when that happens, more people are hired and they're paid more, and those individuals and those companies pay more taxes, and it actually increases receipts to the Treasury. So it's very good to make sure that our veterans who have fought for our country and are now back in civilian life, who are working hard to make their ends meet with their families, to allow them to keep more of their money, because it's not the government's money, it's their money, and especially our small businesses who also employ our veterans to make sure they're able to grow. And when you have a growing, healthy, organic economy, you have more tax revenues not left. Second of all, Mr. Chairman, before I yield back, I would like everybody to take note of who voted for a balanced budget amendment to the Constitution. That would be a very interesting vote for the constituents to take a look at, so we can make sure that all of our families and that have to balance their budgets, and all of our municipalities have to balance our budgets. And when I was in state treasurer in Maine, we had to balance our budget. To see who, in fact, in this chamber and beyond have voted to make sure that we balance our budget here in Washington. And there have been recorded votes dealing with a balanced budget amendment to the Constitution, which I support. Thank you, sir. I yield back my time.
Thank you, gentlemen, for yielding. Ms. Brownlee, you're recognized.
Thank you, Mr. Chairman. I want to yield my time to the ranking member.
Well, once again, and this is our opportunity to change it, I just want to say this, that I do not deny, and many of you have seen us, this is not talk, we've done it. I do believe that we've set the tone on bipartisanship, but I think there's a troubling pattern developing, and I think today it's come to a loggerhead, that we are included on the policy side of things, we are not included on the pay-for side of things. And policy without pay-for is nothing. It happens all the time around here. So I have to tell you, when it comes to some of these inputs, I'm going to believe, because I trust the folks in here, that the reason we withdrew the amendment on the caps was because I made such a compelling element that it just swayed the entire committee over to me on that. Because the other alternative is we knew we were going to pull that, send it to the floor for a manager's amendment where we're locked out and it's going to happen anyway on the pay for. That's the other alternative to that, other than it's, you know what, he's right, we should pull that off. Because keep in mind, after we vote for this, it will go to the floor, it will go in the traditional record-setting way of a closed rule, the most closed rules of any Congress in the history of the United States, and it will be our last opportunity to have any say in that. So by bringing this forward now or debating this amendment in the nature of a substitute, this is our last opportunity to get at that. But we always come back to this. It's almost as if we're crossing a line that we're not allowed to go through. We'll let you work on the policy side of things, but the minute we have to make the hard choices, the minute we have to reflect our values of there, you are no longer welcome to be in that discussion. And I think that's where this is starting to cause the friction. It's starting to get us to these dead ends, and it's happened already twice in this Congress that we predicted what would happen is it would come back from the Senate, we would conference this and get this thing through. It is going to be much more difficult because the next time we do that, It will be with the projected deficits and the projected lack of revenue, and again, you're going to be asked where the money comes from. So I ask you to vote yes on this nature of a substitute, take our base bill, take all of our policy decisions that we wrote together, the best of the House version, the best of the Senate versions, pay for it, let's go forward. I yield back.
Thank you, Jim, for yielding. Anyone else wish to speak on the amendment nature of a substitute? Hearing none, the question now occurs on the Waltz Amendment in the nature of a substitute to H.R. 4242. All those in favor say aye.
Aye.
All opposed say no. No.
Mr. Chairman, I ask for a recorded.
A recorded vote's been requested. Clerk will call the roll.
Dr. Rowe.
No.
Dr. Rowe votes no. Mr. Bilirakis. No. Mr. Bilirakis votes no. Mr. Kaufman. No. Mr. Kaufman votes no. Dr. Wenstrup. Dr. Wenstrup votes no. Ms. Radewagen.
Nay.
Ms. Radewagen votes no. Mr. Bost.
No.
Mr. Bost votes no. Mr. Poliquin. Mr. Poliquin votes no. Dr. Dunn. Dr. Dunn votes no. Mr. Arrington. Mr. Arrington votes no. Mr. Rutherford. Mr. Rutherford votes no. Mr. Higgins. Mr. Higgins votes no. Mr. Bergman. Mr. Bergman votes no. Mr. Banks. Mr. Banks votes no. Ms. Gonzalez-Colon. Ms. Gonzalez-Colon votes no. Mr. Waltz.
Yes.
Mr. Waltz votes aye. Mr. Takano. Mr. Takano votes aye. Ms. Brownlee. Ms. Brownlee votes aye. Ms. Custer. Ms. Custer votes aye. Mr. O'Rourke. Mr. O'Rourke votes aye. Ms. Rice. Ms. Rice votes aye. Mr. Correa. Mr. Correa votes aye. Mr. Sablon. Ms. Esty. Ms. Esty votes aye. Mr. Peters. Mr. Peters votes aye.
47.
Mr. Chairman, the vote is 9 yeas and 14 noes.
And the amendment is not agreed to. The amendment nature of a substitute is not agreed to. That concludes the amendments. I now recognize Vice Chairman Bilirakis for a motion on reporting H.R. 4242 as amended.
He doesn't.
Thank you, Mr. Chairman. Mr. Chairman, I move that we favorably report H.R. 4242 as amended to the full House.
Thank you, Mr. Bilirakis. I would like to ask for a recorded vote on H.R. 4242.
Dr. Rowe.
Yes.
Dr. Rowe votes aye. Mr. Bilirakis. Yes. Mr. Bilirakis votes aye. Mr. Kaufman. Aye. Mr. Kaufman votes aye. Dr. Wenstrup. Dr. Wenstrup votes aye. Ms. Radewagen.
Aye.
Ms. Radewagen votes aye. Mr. Bost. Mr. Bost votes aye. Mr. Poliquin. Mr. Poliquin votes aye. Dr. Dunn. Dr. Dunn votes aye. Mr. Arrington. Mr. Arrington votes aye. Mr. Rutherford. Mr. Rutherford votes aye. Mr. Higgins. Mr. Higgins votes aye. Mr. Bergman. Mr. Bergman votes aye. Mr. Banks. Mr. Banks votes aye. Ms. Gonzalez-Colon. Ms. Gonzalez-Colon votes aye. Mr. Walls.
No.
Mr. Walls votes no. Mr. Takano. Mr. Takano votes no. Ms. Brownlee. Ms. Brownlee votes no. Ms. Custer. Ms. Custer votes no. Mr. O'Rourke. Mr. O'Rourke votes no. Ms. Rice. Ms. Rice votes no. Mr. Carrera. Mr. Carrera votes no. Mr. Sablon. Ms. Esty. Ms. Esty votes no. Mr. Peters. Mr. Peters votes no. Mr. Chairman, the vote is 14 yeas and 9 noes.
The motion is agreed to, and H.R. 4242 as amended is reported favorably to the House.
Mr. Chairman.
Yes, sir.
Pursuant to House Rule 11, Clause 2L, I give notice of my intent to file minority and supplemental additional or dissenting views.
Okay. So summarizing our work this morning, the committee has voted to report H.R. 4242 as amended favorably to the House. And from the chair, I will say reported sadly, to the House. I am very disappointed in this vote with the effort that, that both sides of the committee have done this. It's really unfortunate because it's great policy. And I think everybody up here agrees on that. Everyone here has the ones that voted no against a bill that they helped write and were an original co-sponsor. So I ask unanimous consent that the committee staff be authorized to make technical, clerical, and conforming changes to the bills favorably reported today. Hearing no objection, so ordered. I also ask unanimous consent that all members have 5 legislative days in which to revise and extend their remarks and insert extraneous materials on any of the bills reported favorably today. Hearing no objection, so ordered. I thank the members for their attendance, certainly, and wish everyone a Merry Christmas and safe travels during this holiday season, and have a wonderful New Year. The committee is adjourned.